A hurricane, a pandemic flu outbreak, an earthquake, a terrorist attack. No one knows when the nation, states, cities, or communities could be overwhelmed by a catastrophic health event. Public health departments and hospitals commit a tremendous amount of personnel and resources to plan for local emergencies. They work together to stock supplies, train staff, and conduct exercises to ensure that they are prepared. But when the number of people impacted or the nature of the event is truly catastrophic, state and local public health systems may find themselves without the supplies they need for an effective response. That's why, in 1999, Congress mandated that the Department of Health and Human Services and the Centers for Disease Control and Prevention, CDC, establish what is known today as the Strategic National Stockpile, or the Stockpile. Designed to supplement and resupply state and local medical materiel, the stockpile is postured for a rapid, coordinated response. Within CDC, the stockpile is managed by the Division of Strategic National Stockpile, a staff of public health, logistics, and emergency management professionals whose mission is to deliver critical medical assets to the site of a national emergency. The stockpile has been called into action during such crises as the terrorism attacks of September 11th, the subsequent anthrax attacks of October 2001, and Hurricanes Katrina and Rita. The Department of Health and Human Services and Congress developed the stockpile to help provide life-saving materiel to hundreds of thousands of people who may have been exposed to harmful agents such as anthrax, plague, tularemia, botulism, and smallpox. The stockpile includes medicines such as antibiotics, antivirals for pandemic influenza, chemical antidotes, antitoxins, and vaccines, as well as medical supplies such as intravenous administration supplies, airway maintenance supplies, and medical and/or surgical items. Many factors are taken into consideration when determining what should be included in the stockpile. Among the factors considered are the medical vulnerability of the population, current biological and chemical threats, the availability of medical products, and the ease of dissemination of these products. Over the years, CDC has developed a variety of approaches in organizing the stockpile and applying its scientific expertise to achieve flexibility, efficiency, and effectiveness. The stockpile is perhaps best known for its 12-hour push packages. 12-hour push packages are deployed mainly when the nature of a catastrophic health event is not well defined. These 50-ton caches consist of a broad spectrum of medicines and medical supplies used to treat people who have been exposed or potentially exposed to health threats. The 12-hour push packages are designed to be delivered anywhere in the United States within 12 hours of the federal decision to deploy. They are positioned in multiple strategic locations around the nation and ready for rapid transportation by commercial partners on trucks or cargo aircraft. If the nature of a catastrophic health event is known, the stockpile can also deliver the specific items needed through managed inventory. Managed inventory resources are comprised of pharmaceuticals, vaccines, and other products specific to either a suspected threat or a confirmed need. Maintained either at CDC-managed facilities or by commercial vendors, managed inventory can be shipped and begin arriving at its destination within 24 to 36 hours after a federal decision to deploy. Managed inventory could be the first option for response, or it could provide follow-up supplies once the nature of the agent involved in the emergency is defined. In case of a terrorism attack or accidental release involving chemical nerve agents, a rapid response is critical. Caches of CDC-owned nerve agent antidotes have been pre-positioned in locations selected by local responders for integration into their response plans. This will allow quick administration of life-saving antidotes. These antidotes are available through the CDC ChemPack program, which is a voluntary nationwide program for placing nerve agent antidotes at state and local levels. Staff from the stockpile help state and local planners optimize their plans to use ChemPack antidotes and to monitor and sustain all ChemPack containers to ensure that they are ready to use. In addition to the deployment of medications and medical supplies, CDC is also responsible for the life cycle management and deployment of federal medical stations. These stations provide non-acute, special needs care or quarantine support capability anywhere in the United States. They are flexible, modular, and scalable, and designed for installation in available buildings or structures. When fully operational, the medical stations can support 250 patients for 3 days. They may also be deployed in 50-bed increments or augmented with additional beds. Deployment of federal medical stations will be directed by the Department of Health and Human Services. Although the medical stations can deploy with federal clinical staff, it is not a standalone capability. Local responders must identify suitable buildings or structures to house the stations and plan to provide support staff and services. If items needed during an emergency are not available in the stockpile, CDC can rapidly acquire them through commercial partnerships with manufacturers and major vendors. In a public health emergency, requests for stockpile support can be made through several different channels, depending on the timing and nature of the event. If there has been a presidential disaster declaration, a request should be made through Emergency Support Function, ESF 8. ESF 8 stems from the Federal Emergency Management Agency's Health and Medical Services. This function provides coordinated federal assistance to supplement state and local resources in response to public health and medical care needs during an emergency. The Department of Health and Human Services is the lead agency for ESF 8. Absent a declaration, a state's governor or designated representative would request stockpile support through either the Department of Health and Human Services or the CDC. Once a request is received, local, state, and federal authorities will convene a series of conference calls to evaluate the request, assess the situation, and make decisions on how best to respond. After the federal decision to send the stockpile has been made, federal authorities can provide a technical advisory response unit to assist in the response effort. The Technical Advisory Response Unit is a team of professionals from the Division of Strategic National Stockpile sent to assist state and local officials with the receipt and management of medical assets during a public health emergency. These professionals are experts in logistics, information technology, emergency response, and security. Team members are on call and ready for rapid deployment at all times, with an ability to be on scene and ready to assist within 12 hours of the federal decision to deploy. Multiple advisory teams can be provided for simultaneous deployments. Once on site, the team assists state and local officials with coordinating and facilitating the receipt of assets at a state's warehouse, transferring assets to state and local authorities, ordering additional material if needed, and managing stockpile inventory. Delivery of stockpile assets will begin once a request has been made and approved. Stockpile staff and commercial partners prepare ground and/or air transportation and begin loading the supplies destined to arrive at a secure warehouse or building. This secure building is known as a Receive, Stage, and Store, or RSS, site. Adequate preparation to receive the stockpile requires a site that is secure, climate-controlled, and equipped with trained staff and personnel. At the secure site, state and local officials work with CDC technical advisors on final preparations for the receipt, distribution, and dispensing of medical materiel. When the assets arrive at the designated site, responsibility and control of the stockpile is transferred to state and local officials. Prior planning makes possible the efficient flow of supplies from the storage facility to a distribution network to the dispensing and alternate care sites. In order to supply essential medicines to people in need, all states must have a dispensing plan. This is a plan to deliver the stockpile to the affected population as quickly as possible. Depending on the size, nature, and scope of the emergency, a dispensing campaign may employ several methods and may vary by community. Since 2004, the CDC has provided funding for the city's Readiness Initiative through the Public Health Emergency Preparedness Cooperative Agreement to enhance mass dispensing capabilities. The city's Readiness Initiative is a federally funded effort to prepare major U.S. metropolitan statistical areas to effectively respond to a large-scale bioterrorist event. These areas must be able to dispense antibiotics to an affected population within 48 hours. The Division of Strategic National Stockpile provides technical assistance on the planning process by helping to identify needed resources and training opportunities. Metropolitan statistical areas involved in the city's Readiness Initiative are evaluated regularly by CDC technical advisors. Working with many different community partners and agencies, local public health departments are using innovative ways to reach their populations within this 48-hour window. The methods used in planning can be categorized into two categories: push and pull. Pull methods encourage the public to come to identified locations at common areas within the community to receive medications. These are known as points of dispensing, or pod sites. Push methods utilize the current infrastructures of local organizations and relieve some of the burden placed on traditional pod sites. The push method is also employed by community agencies that provide medications to the populations for whom they regularly serve. Other institutions, such as businesses, military installations, and emergency responders, are able to dispense medications utilizing push methods. These organizations benefit by retaining the ability to remain operational during a public health emergency while still providing countermeasures to their employees and their family members. Dispensing methods may vary, but the goal is the same: to save lives. CDC provides guidance, advice, and support to help state and local responders prepare for public health emergencies. 2 stockpile program services consultants are assigned to work with each state. One serves as the primary consultant and the other as a backup. Program services consultants are knowledgeable about stockpile operations as well as state and national emergency response infrastructures. They can serve as the gateway to other subject matter experts within the CDC and facilitate education, exercise, and training programs. The consultants also provide assistance during public health emergencies. They serve as liaisons between the federal government and local responders and as operational and technical advisors for the receipt and distribution of the stockpile. Technical guidance is critical to state and local preparedness planning. The division which manages the stockpile provides instruction that focuses on public health preparedness and medical logistics in response to a catastrophe, specifically in regard to receiving the stockpile. Courses provide detailed instruction on how to request, receive, store, maintain, distribute, and dispense medical materiel. A variety of education, training, and communication tools are employed to share essential information. State and local technical assistance reviews. State and local technical assistance reviews measure key elements identified in stockpile guidance documents. Vital to state and local planning, the technical assistance reviews serve as an independent assessment of a community's plan to receive, distribute, and dispense the stockpile during a catastrophic health event. The Strategic National Stockpile Extranet. The Strategic National Stockpile Extranet is a password-protected website that serves as a forum for thousands of state and local-level response planners, as well as a trusted source of information and helpful tools. Mass antibiotic dispensing satellite broadcasts. The mass antibiotic dispensing satellite broadcast series are used to highlight key elements of preparedness. Archived video broadcasts can be viewed on the internet and are also available on CD-ROM and VHS upon request. Computer modeling and simulation software. Computer modeling and simulation software is designed to aid in planning and to complement live exercises and drills. Computer modeling assists state and local service providers in simulating a real event. With these tools, planners can help assess the capabilities of distribution and dispensing plans. Workshops and conferences. Workshops and conferences provide a forum to share strategies, best practices, and lessons learned. The goal is to enhance national public health and medical preparedness. Guidance documents. Guidance documents help clarify to public health planners what the necessary requirements are to receive, stage, and store stockpile assets. Listservs. Listservs are another tool for information sharing between the nation's state and local emergency preparedness professionals. Response officials and state coordinators use listservs to build communications, cooperation, and teamwork across the country. Exercise program. The Division's comprehensive exercise program contributes to the nation's readiness to respond to a national emergency. The two main goals of the program are to validate the Division's ability to effectively deliver critical medical assets to the site of a national emergency in a series of response scenarios, and to provide support to state and local stockpile exercises designed to test and validate their emergency operations plans. As a result of the resources and the overall preparedness efforts at the federal, state, and local levels, America is better prepared for a catastrophic health event. But planning efforts must continue, as well as continued communication and shared resources between both the public and private sectors. Some large-scale natural disasters, such as hurricanes and floods, can sometimes be anticipated, but other catastrophes or acts of terrorism are not predictable. Regardless of the type of disaster, advanced preparations and planning are crucial for a successful response. That is why the stockpile is a vital resource for states, cities, and the American public. At its core, the stockpile has two main goals: to help state and local governments prepare for a catastrophic public health emergency, and to respond quickly if a public health emergency occurs. The mission is simple: deliver critical medical assets to the site of a national emergency. Deliver the right assets where they are needed, when they are needed, to help states and cities when they are overwhelmed by a disaster. The stockpile is a critical national resource, a leader in emergency preparedness, a collaborative partner, a public health asset, a lifesaver. The country can feel more secure knowing that the stockpile is ready and able to respond to any catastrophic health event. For more information about the stockpile, please visit the website at www.emergency.cdc.gov/stockpile.